This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
It's
Supposed to
second.
help us or
Medical Dilemma.
Hi, I'm Sonny Del Rosario, and you're watching Medical Dilemma. Nowadays, there is heightened awareness of the issues that surround gender, and it seems that the matter is no longer limited to women, and now encompasses men and even members of the LGBT community. To find answers to the many questions about gender sensitivity, we have the chair of the Department of Anesthesiology of the Manila Doctors Hospital and a clinical associate professor of the Department of Anesthesiology at UP-PGH Medical Center. He's also a former member of the Bioethics Committee of the Department of Anesthesiology of the Philippine General Hospital. Let's welcome Dr. Robert Gomez. Welcome to the show, Dr. Gomez.
Thank you for having me, Sunny.
Yes. Now, first of all, let's start with your background as a doctor. What do you do?
Well, I practice anesthesiology. I trained in PGH, and I put patients to sleep.
Okay, you put
And
patients to
I wake
sleep.
them up,
Yes.
and of course then make sure that they wake up.
Right. And how did you end up in this subspecialty?
Oh yeah, because I have 3 role models in my family. I have a radiologist, brother of my mother, a surgeon, my uncle, and I have the brother of my father, who was an anesthesiologist.
Oh, so you come from a long line of anesthesiologists.
All doctors in the family. And the anesthesiologist is the one I admired the most.
I see.
He was a complete doctor. He was a clinician. He was also a academician. So
Yes.
he was a pretty famous guy. So I admired him a lot. And that's why I chose the specialty.
I see. Now, this is very interesting. No? You're an anesthesiologist, but our topic is gender sensitivity. So what's the connection between the two?
Well, I happened to comment on the magazine of Dr. Sanchez.
Yes.
And because I did attend the workshop in the late 90s
All right.
in UP Diliman as a project of the UP College of Medicine. I represented the department in a gender sensitivity workshop. I think it was one of the first workshops.
You mean in the Philippines?
Probably of that time.
Of that time.
Yeah, because it wasn't a common word, gender sensitivity.
Okay.
It was just, I think, the pioneer of the workshops that were to follow.
And how was the experience joining the workshop then?
Well, of course, I was hesitant, Sunny, to go join it. In fact, I was the only male who joined the workshop.
Really? So the only male among the
And
women.
I was surrounded by very powerful women. The former dean was there of the College of Medicine. My senior professors were also there. I think, if I remember right, I was the only man who attended or volunteered to attend the workshop.
I see. Didn't you see any other men who probably
I
backed
don't
out
remember.
at the
I think
last
I was the
minute?
only one. I was the only one in UP Diliman
Okay.
to attend the workshop.
All right. And what were the lessons that you picked up from that workshop then?
It was more than about 20 years ago. So, but I always remembered it to watch what you say, like as I can clearly remember, chairperson instead of chairman, or chair instead of
Yes.
chairman, to refer to anyone, male or female. That's what I remember, and that's what I thought. What gender sensitivity was all about. It's just terminology.
Okay.
Just avoid things that have a man gender at the end of the word.
I see. Now, nowadays, does gender sensitivity really refer to just the use of words, terminologies, or are there other perspectives or angles that we need to be aware of?
Well, because I did some Googling. I Googled it. It seems to be more than that. It was, well, going back to my UP dilemma, the first thing that came out of my mouth was, oh, this must be a women's lib activity.
Okay.
Because in the 70s, that was the most common thing in the news, in the American news. So with that background, I found myself saying that this must be a women's lib thing. I just go along with it. I had nothing against it.
Well,
But
you were obviously outnumbered during that time.
Yes, yeah. And I was used to getting orders from females, and I really felt the females were superior to us men.
Okay.
I grew up, my mom was the disciplinarian of the family. My grandmother was also, what do you call that, the head of the clan. And we used to following orders, matriarchal hierarchy. So I didn't have any problems. That's why I was not even aware there was a problem.
Okay.
If you had to be gender sensitive to the words that we use or titles. That's all I thought there was to the idea.
All right. Now, going back to the present time, what do you think is involved further in gender sensitivity discussions, aside from, the use of the right words or terminologies?
Maybe if you're talking to, I don't experience this in the hospital, but maybe if you were in the corporate world, maybe it might be different because you'll be getting orders from someone. That might be a problem probably for macho men.
Okay.
Getting orders from female bosses. But in med school, we were already ingrained that we were equal. The UP College of Medicine, when I entered in 1982, 50% female, 50% female. Male and female.
Female,
Yeah,
50%.
Yeah, 50%. The girls had higher grades, so the cutoff for their entrance to the College of Medicine was much higher. They were actually very smart.
Much higher.
They had higher grades and they were smarter. So, from that early, I was already used to having the equal footing with females.
So this cutoff grade, which was set higher for women, was used to sort of preserve the ratio of men
to
and
preserve the
women.
ratio. 50 men, 50.
Okay, so
50%
50% men,
female.
50% female.
Yeah, the UP already observed such sensitivity, if you want to call it that.
All right.
They were already attuned to that. 50% females. So in a class of 130 or 140, we were 140. 70 females, 70 males.
Okay, and this, I guess, goes to the equality question of gender.
Yeah, so that's why in respect to your answer, the question, I was not aware there was a problem between men and female as far as the workplace. I was not aware.
I see. Well, in my experience, I've had a lot of bosses who were women in the business world, and most of them had remarked to me that they do assert themselves as women, but when they play the management game, they play as men. So I'm a bit, shall we say, confused as to what gender sensitivity really is about. Okay, so do you have the same experience in medical practice?
I did not experience that much. Maybe in the operating room, choosing between a male surgeon or a female surgeon, because I'm an anesthesiologist, they are equal qualities and training. But sometimes I really felt sometimes in a serious dilemma or a crisis in the operating room, sometimes the female surgeon would talk more than the male surgeon. That's all. But the skills are the same. But I noticed the male surgeon, keeps quiet. But the female surgeon would talk more or fidget more. I don't know if it's just my imagination, but I don't know if you have that experience. But they are equal skill, but the man just keeps quiet. Of course, there's some exceptions, but most of the men surgeons, they just keep quiet.
Okay. Well, thank you so much, Dr. Gomez. At this time, we'll have to take a break for a couple of minutes, just a few words from our sponsors.
Thank you.
comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?